I just share my slide. Is my slide is visible?
Yes, ma'am.
Okay. Okay. So,
Yeah.
good evening, all of you. Hello. Am I audible?
Yes, ma'am. Yes, you are audible.
Okay. I just wanted to see all the. Okay. So, I would like to know all our faculties, na? College of Nursing faculties, na? Shiba?
Yes, yes.
Okay. So, I see Dr. Jaideepa. Ma'am, do you remember me?
Ma'am, I don't know. Actually, I am driving now.
Uh-huh. Okay,
I'll
okay.
reach home in 5 minutes.
Okay, okay, okay. So, good evening, all of you.
Good evening, ma'am.
Before going to the topic, I would like to know about few questions. Okay, so I don't know whether you will be able to do this, but please answer to my questions. So, can anyone tell me who is the founder of modern hospice movement in this group? Hello, am I audible?
Yes, yes, ma'am. You are audible.
Okay, can anyone tell me who's the founder of modern hospice movement? What happened? Nobody is answering.
Ma'am, Dame Cicely.
Full name? Only half
Dame
you
Cicely
will get.
Saunders.
Yes, very good. Thank you so much.
Thank you.
And can you please name few nursing courses which are recognized by Indian Nursing Council? What are the nursing courses recognized by INC?
GNM, BSc, MSc,
Hmm.
NPCC.
Anything else? Okay. So do you have separate nursing subject as palliative care in India?
No.
Okay. Do you think that palliative nursing care needs to be integrated into nursing curriculum?
Yes, must.
Okay. Do we have palliative care separate medical courses in India?
I think no.
No. Okay. What are the advantages to the society by integrating palliative care in nursing curriculum? Anybody? What are the advantages for the society?
Nurses will be aware of it, no? So when they can do a better care and they can understand who really needs palliative care, they can be an advocate for patients if they have a knowledge.
Ma'am, what is the advantage for the society if we integrate palliative care in nursing curriculum?
Maybe their quality of life will be improved to some extent.
Okay,
In the
thank
sense, it's
you.
not completely.
Okay, ma'am. What are the advantages to our students?
Another scope of practice.
Okay, what are the advantages for us as a teachers?
For us also, it widens the scope again. We will have a better understanding, knowledge.
Okay.
We also can be advocates.
Okay, ma'am. Can you please suggest any way we can integrate palliative care in nursing curriculum? There are I think 16, 17 participants are there. Everyone can give a
Actually, I am driving. If somebody else can answer, it will be better.
yeah. Can anyone suggest few ways to integrate palliative care in nursing curriculum?
Actually, in nursing curriculum, we have a mandatory module of palliative care, ma'am.
Yes.
But it should be as a subject, and there is no compulsory posting for palliative care, actually, clinical posting also.
Okay.
We only post in oncology. Students should be exposed practically to the palliative care ward, so that could be included in the nursing curriculum.
Okay, very good. Thank you so much. Anybody else?
Keeping a palliative nursing as a one unit under oncology nursing, it
Yes.
should be better.
Yes. Anybody else?
So, like this, recognized fellowships, courses.
Okay.
Like NPCC, in palliative care also INC can bring.
Okay. Anything else? Anybody else? 20 to 20 faculties are there. Any other ways we can integrate? Okay. What are the challenges we may face? Currently, you said that students are not getting clinical postings, and it is also mandatory module only. It is not a subject as such. So, what are the challenges? Any other challenges we face when we integrate palliative care into nursing curriculum?
Lack of resource materials.
Resource
Focus on
materials.
palliative nursing.
Okay. Ma'am, I will give you what are the references we
Okay.
have. I can share it to Shiba, and Shiba can share it to the group. Okay, ma'am.
Okay, ma'am. Thank you.
Okay. Anybody else? What
As
are
I told first, palliative clinical is not available in all the hospitals. It is not available in the rural areas mostly.
Resistance.
Okay. Why my slide is not going into slide share? Okay. Okay, so thank you all for your contribution. So all the questions will be answered in the upcoming slides. Okay, so why we are talking about, if you see palliative care in foreign countries and also in India, some part of the country, palliative care has been advancing. Okay, and lot of expertise are coming up in palliative care. Okay, so as I asked one question, what is the advances happened in palliative medicine? They are having a DNB palliative medicine. They are having a MD palliative medicine, which is approved by the medical council. Whereas to integrate this 20 hours palliative care module, how much Pallium India and the other organizations struggled, okay, which I will be explaining you further. Okay, if you take in India, we have 55 lakhs patients needs palliative care as of now. Okay, as of now, 55 lakhs patients needs palliative care, which is increasing because of the chronic, non-communicable diseases and cancer we are early identifying, and so many other our like people's consciousness towards health is being improved, and the status of health is also improved, and people are like trying to improve the health through various ways. Okay, so now we are having more patients comparing to the before. So if you take in India, this is by Dr. Rai J. George, K. George, president of TNI earlier. Okay, it came in one of the news article. He said that 2 lakhs nurses registered every year. So in that, 40 to 50% of them go abroad. So still, even if 40 to 50, even if 50% goes to abroad also, 1 lakh nurses are still in India. Okay, even if each can cater 55 patients per year, okay, so the 55 lakhs can be covered. So that is the intention of us, so that no patient will go, no palliative care patient will go without managing their symptom, without venting their stress, struggle, suffering. Okay, so that is why we wanted every one of our nursing students should know about palliative care. What are the roles and responsibilities of the nurses working in palliative care? How, as a nursing faculty, how we can integrate the palliative care into our curriculum. And even if the curriculum is not integrated, what are the ways we can integrate palliative care into our teaching? That is what I am going to talk to you. Okay, so in current nursing curriculum, I 100% agree that, and you also will be agreeing that students are trained to provide compassionate care. Am I right or wrong?
Yes, sir.
Yes, ma'am.
We are training our students to our level best to provide the compassionate care. However, the concept of holistic approach and nursing care of palliative care patient teaching is lacking to a remarkable extent. Okay, so that is, say, today also I was there from 7:30 till 6:50 in the hospital. One of my friend had a severe abdominal pain, and doctors were trying to, I really saw how difficult to manage a acute pain. And suddenly from 7:30, now 2 o'clock only, diagnosis confirmed, Meckel's diverticulum, and it was operated. Now my friend is peacefully in ICU under anesthesia. But the half 5 hours, how much struggled. Okay, the entire team was like, everyone was having the pain. Okay, so that attitude we are not seeing among few of our nurses. Okay, so you all may be very familiar with this nursing definition. Actually, now the definition they have changed, but I really love this nursing definition because it is not separating nursing and the palliative care in different angle. Okay, I can see the palliative care in this definition. I can feel what they wanted to, what we want to do for a palliative care patients. It is there in our definition. So palliative care is not at all a new subject for nurses who have learned this nursing definition, who have trained in a institute where nursing is given a priority. Okay, so the unique function of the nurse is to assist the individual, okay, individual, sick or well. Okay, the person is, whether he is sick or he is in a good condition, we want him to work independently. Okay, in the performance of those activities contributing to health or its recovery or to a peaceful death. Okay, so there the palliative care come into this. So we also in palliative care, we not only take care of the patients, okay, who are like, we know that palliative care, we take care of patients from the time of diagnosis till death. Beyond death also, we go and give a bereavement care to a family, okay, the caregivers who have lost the loved one. Okay, so you can see the peaceful death. Okay, that is what we wanted in palliative care. We want our patient to have even the death should be a quality death. Okay, that is what it is there already in 1966 itself. Virginia Anderson has written this definition that he would perform unaided if he had the necessary strength, will, or knowledge. We are not only taking care of the patients in cancer, we are also taking care of patients, paraplegia patient, quadriplegia patients, patients with the neuromuscular disorder, patients with the chronic illness. So we take care of these patients also. If we teach them properly, teach the patient as well as the caregiver, okay, he would perform unaided if he had the necessary strength, will, or knowledge. So the will, knowledge, and the strength, who's giving? The palliative care nurses are giving to our patients who are in palliative care. So this is the definition given by Virginia Henderson. Okay, so followed by that, and I am very proud that to say that the palliative care has emerged from the nurse. You all know that Dame Cicely Saunders, she was a nurse. Okay, later on, what she wanted to do to a patient, because she was very tall and beautiful and very, like, I have read in the story, and so she developed the back pain and the long standing hours. So she don't want to leave the service. So she did social worker. That time also she couldn't do much what she wanted to do for her patients. So then she thought, okay, let me do medicine, so that I can do what best for my patients. So like that, later on she did medicine. Okay, she is also a nurse. Okay, then the middle person you all may be knowing, Gilliburn. She was a nurse who came from. Okay. Others, please mute. Okay, so Gilliburn, who came from India to train, to disseminate about or sensitize about palliative care in India, and who found Dr. Rajgopal, and I learned from Rajgopal sir. Okay, so I really, you see, in India, the palliative care is, the seed is put by a nurse. Okay. So the major milestones happened in India was, there were multiple advocacy initiatives had been underway for more than 20 years. In 2006, the government of India formed a committee to create a national policy for palliative care. And 2006 and 2007, the initial attempts to integrate palliative care into the UG medical and nursing curriculum were started. Okay. And this is the letter. Okay, so you can see in this letter, Dr. Rajgopal sir name is there, Susma ma'am name is there. Okay, so many people were there in the initial period itself. Nandini madam. Okay, so you may be knowing few people's when you come across palliative care. Okay, in 2012, with the participation of Indian Nursing Council, the Ministry of Health and Family Welfare declared the national strategy for palliative care. And then an essential aspect of this strategy was to appropriate inclusion of palliative care in the UG nursing curriculum. It happened in 2012. Okay. So 2013 also again meeting happened. They prepared the preliminary module. Okay, and then 2013 to 22, I listened to Dr. Rajgopal sir was during one of his lecture, how many times he and his team used to go to INC, visit the INC and try to meet the president of INC, and then sometimes they would be able to meet and sometimes they won't be able to meet, but still they didn't give up. Okay, so multiple advocacy initiatives by different palliative care organizations happen in India. So this is also in 2018, the appeal to have increased number of hours on palliative care in the nursing curriculum and a specialized nursing courses exclusively on palliative care submitted to Dr. T. Dilip Kumar, President, Indian Nursing Council. Okay, it came in one of the Facebook information. Okay, in 2017 and 18, development of facilitator guide and training manual, training schedule for training of doctors, nurses, ASHA workers and community health workers, training of the trainers were happened in under the National Program for Palliative Care. And 2018 and 19, integration of palliative care to UG postgraduate modules at Kasturiba Gandhi College of Nursing, Puducherry, South India, in collaboration with Pallium India was started. Before INC could integrate, this private university integrated, okay, with the support of Pallium India. Okay, you can see Jilliburn, Dr. Raj Gopal, and the director of MGMC, and she is Sumati madam from Kasturiba Gandhi Nursing College. So they were all there. And in 2022, Indian Nursing Council, the integration of palliative care into second year BSc Nursing as 20 hours mandatory module, 2022. And then in 2022 May, they published the competency and sub-components. What should we teach to the BSc nursing students? So that was given. And 2022 June, Pelham India started the preparation of modules with a national team of nurses. So I am very thankful to Pallium India. And I was given the assignment with Sheba, Anu, and Stella ma'am, and many other, Sangeeta, and many others from all over India. We all started preparing the module. If you go to Google and you can see the module, okay, if you put INC module by palliative care module by Pallium India, it is there in the Google. It is free to use. What all the teaching materials are there in the which we prepared. Okay, it was in the early period, so there may be many things we had also had a restriction, like within this this many words only to be written, so like that. So we have restricted the number of words in the module. Okay, so then in 2023 Jan, the modules were completed and submitted to the INC. So this was presented in 2000, I think 3 years before in the international conference in palliative care. And so I was asking you, what are the courses recognized by INC? So you can see that ANM, GNM, basic BSc, post basic, MSc, MPhil, PhD, nurse practitioner, critical care, and post diploma courses, burns and reconstructive surgery and residency program, hematology nursing residency program, forensic nursing, neonatal nursing, geriatric nursing, ortho and rehabilitation, oncology, critical care nursing, midwifery, orthopedic, cardiothoracic, operation room, neurology nursing, psychiatric nursing, emergency and disaster nursing. Okay, these many things are there. If you see in MSc, there are many subspecialty in medical surgical nursing. In the oncology nursing, only 10 hours is given for palliative care. Okay. And then if you go to hematology nursing and geriatric nursing, oncology nursing, everywhere they have given only 10 hours only. Okay. So they have not given more hours for palliative care nursing. So that is why now some of the organizations, like I think Tata Memorial Institute, they are giving a 1 year of post-diploma courses. It is recognized. Okay, so that is not there in INC website. Okay, if anybody want to refer, please refer INC website. If it is there, please share. I have checked recently. It is not there in the INC website. So in India, establishment of palliative care organization are increasing. There is a need to work on, like post-diploma palliative care nursing. INC announced in 2024-25, and many places it is not yet started. MSc in palliative care nursing, we need to start because medical, they have already started the MD community palliative care medicine and DNB palliative care medicine. And we also need to start the palliative care nurse practitioner courses. So in this team, I see many principals are there and many faculties are there. You can like give the importance, okay, to you can share this information to a council, okay, council registrar, whenever they come and whenever you get an opportunity to meet them, or through the collective effort of all the colleges, you can talk to a registrar, like council registrars. Then the council registrars will take it to the INC. Okay, only when we all work together, we will be able to achieve this. Okay, so what is our aim? Our aim is to ensure that future nurses develop essential skills and knowledge to provide holistic, compassionate, and evidence-based care for patients with life-limiting illnesses. Okay, you people cannot just think that palliative care can be given by anybody. Okay, palliative care should be given by the qualified professionals. Okay, so then because based on the evidences. Okay, without evidences, like Shiba is very strict. If whatever, like whenever she asks me to take any session, if I ask Shiba, I'm going to add this, she will ask, ma'am, is there a evidence? Okay, so palliative care also provided based on the evidences only. Okay, so importance of palliative care in nursing education for students. That is the question I asked you. The students will be able to develop the competency in managing the patients with chronic or life-threatening illnesses. And they get the confidence in handling the patients in end of life care situations. And I remember when I was a student, when death is happening, we all will be going and standing in one corner and crying. Okay, so that type of students we should not produce now. We should produce nurses who will be able to stand in front and support the caregivers and also the patients. Okay, that type of students we should be able to produce. And what are the benefits for the healthcare system? We get a better outcome and family satisfaction, reduce healthcare costs due to the effective symptom management, and fewer hospitalization. If we know that particular patient is in end of life care, okay, patient may die within few hours or few weeks or few months. Okay, if you prepare the family and the patient very well, they will not take them to a hi-fi corporate hospitals. They will not admit them in the ICU, and they will not be wasting the economy. Okay, so they will understand. They will understand there is no need. Okay, let us give a comfort care to a my own father. Let us give a comfort care to my own relative. Like that, they will think. They will give priority to the quality of life of the person instead of putting. We are witnessing. A patient is going to die within few hours. Still, the blood transfusion is going on. We know, like patient with the chronic illness, patient with ALL, AML. Okay, patient is bleeding another side, patient is coma, but still we are pricking the patient for ABG, VBG. Okay, so this all can be reduced only if the family and the patient understands. Okay, it is a challenging task, but only through continuous effort, collective effort, we will be able to achieve. Anybody has difference of opinion in these 2 points? Hello, are you all with me? Hello,
Yes, ma'am.
are you all with me?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
You are able to follow me now?
Yes, ma'am.
Okay, okay. Okay, what are the importance for the society? Okay, we know that number of patients, like in my village, recently I went to my village during my election. Okay, I see many people are coming in wheelchair to vote. Okay, I never thought that this many people are there who need palliative care. And I went and visited many families. I can see 1 or 2 people in the family with the chronic illness or cancer undergoing treatment. So the need is palliative care need is growing like anything. Only thing, they are all going to a curative care. Okay, they are nobody aware of the palliative care. Okay, and we are the one we first recognize and respond to the palliative care needs. Okay, so when we recognize and respond to palliative care needs, definitely many aspects like economy, the struggle, patients will be well prepared and they will know what to do. They will write the advanced directiveness. Okay, there are a lot of advantages are there if you integrate palliative care into nursing career education, so that the nursing students and the faculties will come to know, because we are the one in the front of the patient. So we will be educating the family, what are the opportunities available for them, that we will be teaching to them. Okay, for our faculties, as madam said, that we enhance our teaching capabilities. Okay, professional growth and leadership opportunities, we will take it up, and we will educate our students in a competency based. Okay, we work for the competency development among our students. Okay, to enhance teaching capabilities. Okay, so whenever I take class, okay, recently my husband took me to a medical college to educate the medical students about, like, sensitize the medical students about the palliative care. Okay, first one, SR took the session. Everyone was with the laptop. Okay, everyone was with the tab. Everyone's ears were with the headphones. They were listening to the videos, okay, of their PG exams. Nobody listened to the class. Okay, as soon as next session was mine, when I went, I said, please answer to my questions. Okay, then only half of them were removing the headphone and closing the tab, and they were listening. Okay, and then I started giving lot of examples, like how we have given care, how the patients had a quality of life improved, how the families were empowered. Okay, so when I finished, when I was about to close my session, I can see everyone's headphone was down and everyone's that tab was closed. Okay, so that type of capabilities we develop because we wanted to give quality of care to our patient. So they are the main people. So they have to listen to our like experiences. Okay, so for that we develop by looking at the students, by when we are sharing our experiences. Okay, we enhance our teaching capabilities. Okay, what are the challenges and solutions? We all know that we have limited faculty expertise in palliative care. Okay, for this only, now Pallium India and even IAPC has taken the step to train all the nursing faculties. Okay, if you can go to IAPC website also, there they have started training the, I have recently went to Bhubaneswar to train the faculties. Okay, so Pallium India, this is, I think, second time I'm taking this, third time I'm taking the session. I think maybe the third team. Okay, so like this, when this type of training is there, if any principal is there in the team, please allow your faculties to attend this type of courses so that it is for the welfare of the society. It is for the welfare of the patient. It is for the welfare of our profession. Please allow them for such type of training. And we know a lot of resistance for curriculum change. The story which I have told you, how many years the Pallium India and the other organizations struggled to integrate this 20 hours of palliative care module. Okay, there were a lot of resistance. Okay, when I went after getting training from Pallium India, I went and spoke to a registrar of my state. Okay, what she told was, what a big deal you learned from Pallium India. Okay, it was really hurted me, but today that state is flourishing with palliative care. Okay, there are a lot of courses, lot of training going on in palliative care. So there are a lot of resistance will come from different places from our institute. Okay, in my institute, when I talked about palliative care, they said you are a death nurse. Your husband will become a death doctor, you will become a death nurse. Do you want that label? Like that, they asked me. Okay, everywhere we face a resistance. When you anywhere when you bring some change, you will face a resistance. But as Rajagopal sir always says that, take a deep and small step. Okay, whichever step you take a small step, but never give up. Okay, so that is the show the world that how palliative care improves the patient outcome. Okay, I don't have a time to explain how like challenges we faced, how we integrated palliative care in our institute. Okay, one of the patient son went and told the chairman how we took care of the patient. Okay, the next day itself, the chairman called me and my husband. You start the palliative care. I am giving you 10 beds, 5 for female, 5 for male. I will make sure that I will call of the common meeting of all the departments. I will tell them that you are starting, they all must cooperate with you. If any resistance you face, please let me know. So like that. So you have to show the world how palliative care improves the patient outcome. Okay, then the change will come slowly. Okay, and we need to balance the workload. I know it is going to be a big workload. See, now you people are sitting and listening because you are all interested in palliative care. You see me from 7:30 till 6:50, I was in OT, ICU. Still, I am coming and taking class because I love my palliative care. Okay, I love teaching palliative care to people. So we need to balance the workload. If you love your profession, if you love your like service, definitely you will never feel that it is a workload. Okay, so provide time and incentives for faculties to pursue palliative care nursing. Okay, when I got training in Pallium India paid me my 5,000 rupees for that palliative certificate course. Okay, because that time my institute was not supporting. After that, when I came back and we started palliative care, we sent nurses through our institute. Okay, they gave 6 weeks with full salary for them. Okay, so like that, only if you take initiative, you can achieve. Okay, what are the ways we can integrate palliative care in every subject? Okay, so in foundation, see what I do is when I go to palliative, when I go and teach my first year students, I will not directly go and teach about subject. Okay, I will give the case scenario. I will link my topic with that case scenario, and then I will tell them what is most important for nursing. Okay, in that subject. For example, if you go to foundation, okay, so you can teach about the palliative care concepts. Okay, basics of palliative care principles, like what is holistic care. Holistic care includes physical, psychological, social, spiritual. Okay, that is palliative care. Okay, comfort measures. When we are teaching comfort measures, when the patient is having a breathing difficulty, what we teach is what is the position we give when a patient is having a breathing difficulty. I am asking among.
Paulus position.
Okay, but I will give a position whatever the patient prefers. Okay, whichever position my patient feels comfortable, that position I give, because I know I respect my patient's autonomy. I respect my patient wish. Okay, so today also my friend was having a severe abdominal pain. Everybody was putting Fowler's position, Fowler's position. My friend said, I don't want Fowler's position, put me flat, because that much pain patient was having. Okay, so when we are teaching comfort measures, we have to tell them, okay, Fowler's position, we give it to this type of patients, but if the patient feels discomfort in this position, do not force. Allow the patient to feel comfortable, whatever position he prefers. Okay, give the position whatever he prefers. So like that, we have to teach. Only when we know the basics of palliative care principles, we will be able to teach our students. And ethical and legal aspects, like we have one unit, no, like professional ethics on that topic. So when we are teaching about the autonomy, beneficence, non-maleficence, justice, okay, so we have to teach how important is each one aspect. Okay, and now we have included advanced directives, do not resist state orders. So all these things, when we teach uh, foundation, when we integrate the palliative care into this teaching, it is nothing separated from palliative care and the FON. Okay, all the nursing procedure when we teach, how we can follow at home. Okay, respecting them, like when we are teaching to mannequins, like for that also we have to put the privacy, we have to explain the procedure to the mannequin, and we have to teach, we have to practice with the mannequin. Okay, if you are teaching any procedure in the lab, and same thing we should teach them when we are then there in the bedside. Like we have to ask the, like before that we will tell the patient, I am coming to give bath. Now we should not tell like this. Are you ready to, I am planning to give bath for you. Are you ready? So if the patient says that I don't want to take bath now, I am feeling tired, I want to sleep for some time. After that, I will tell you. So you have to respect the patient's wish. So this type of things, when we are teaching FON, we can integrate the palliative care. Don't need to wait for the INC to bring the separate nursing course for palliative care. Okay, anatomy physiology. When we are teaching anatomy physiology, we have to teach like what are the changes happens in the terminal illness, organ, how organ failure happens. When the organ fails, how it deteriorates, how the patient function deteriorates. What are the dying process? Focus on systems affected in palliative care, like neurological, respiratory, gastrointestinal. Like when we are talking about the vomiting, we have to teach about the different vomiting centers. Okay, physiology. Okay, how it affects. Then only they will understand. They will not give the monotonously same drug to a patients. Okay, so they will know, okay, vomiting has different centers. So we have to so if the patient is having anxiety, we have to go give this medication. If the patient is having motion sickness, we have to go for this drugs. So they will understand. Okay, so aging. So when the patients are elderly patients are also under palliative care. So what are the conditions? What are the risks? Osteoporosis. So the house has to be built with a protective, like a safe, elderly safe environment, bathroom with the side rails, slippery, non-slippery floors. So all those things, when we are teaching anatomy, physiology, we have to incorporate. Psychology, when we are teaching psychology, we have to teach about how the grief, depression, dabda, anxiety, coping mechanism, how we have to communicate with the patient, how the death, discussing about the death, the loss, coping. Okay, and what are the psychological theories in death, like Kubler-Ross, 5 stages, and how we have to take care of those patients when they are denial, anger, aggressiveness. So all these things we can teach when we are teaching the psychology. And biochemistry, nutrition, we need to teach them about explaining about the metabolic changes in terminal illness, cachexia, electrolyte imbalance, drug metabolism, opioid mechanism, adjuvant therapies, how to take care of patients in hydration, nutrition in the end of life care, focus on nutrition in palliative care, diet modification when the patient is having dysphagia, oral candidiasis, cachexia, GI symptoms, ethical dilemmas in artificial nutrition and hydration. You all would have read about Rana's recent like ethical dilemma also you would have learned. Supreme Court judgment also you would have learned. Okay, and teach about non-oral feeding methods like enteral feeding, parental nutrition, when they may not be able to be benefited. Okay, so when we are teaching this nutrition biochemistry, we can incorporate the palliative care concept. Okay, and then community child health nursing. Okay, community health nursing, when we are teaching, we have to teach about how to give care to our home settings like hospice, caregiver education, how we can get the community support, how we can address the public health strategies in palliative care, awareness and access, and cover the when suggesting chronic disease. And am I audible? Hello?
Yes, ma'am.
Okay. So when we are teaching pharmacology, we have to teach about the each pain drugs. Okay, what are the actions, side effects? What is the how much is the maximum dosage, minimum dosage? How many hours it acts? How many hours like peak hours? Okay, so all the pharmacokinetics, pharmacodynamics. Okay, all these things we have to teach to them. And when we are talking about the sociology, we can discuss about the socio-cultural aspects of death and dying, cultural beliefs. We need to respect the culture, rituals, ethics of the patients. And we need to address the healthcare disparities in palliative care and explore the family and social role in caregiving and bereavement. We not only take care of patients who are in life-limiting illness. We also take care of the elderly population. We also take care of the transgenders. We also take care of the people who are deprived of like challenged people. Okay, so that can be integrated when we are teaching about the sociology. And pathology, explain the pathophysiology of terminally illness like cancer, neurodegenerative diseases, organ failure, teach recognition of disease progression, palliative care needs in different stages, discuss the importance of early palliative care intervention and quality of life. When we are talking about child health nursing, the palliative care principles in child health nursing, how to take care of the child with a different palliative care illness, and the caregivers and the siblings, how to communicate with these children, those can be integrated. And psychiatric nursing, like we learn in psychiatric nursing how to take care of patients like grief, counseling, depression, anxiety, discuss the therapeutic communication skills, and distress, like how to identify the distress and how to give proper
Lada ma'am? Hannah?
Yes, ma'am. I think ma'am is facing some network issue. So I have message to ma'am, so we can wait for a few minutes.
Yeah, okay. Good.
Okay. Is it visible?
Yes, ma'am.
I'm sorry, there was a network issue.
No problem. No problem.
Okay. So in nursing education, what all we can do is, like, we can develop modules like this. Okay. And then within our institute also, we can prepare the module, incorporate simulation-based training for end-of-life care conversations like symptom management, encourage interdisciplinary learning with specialist psychologists, social workers. In nursing research, you can promote evidence-based palliative care interventions, encourage studies on cultural influences and palliative care modules, introduce qualitative research methods to study patient and family experiences. See, I have joined in AIMS Jodhpur in 2021 onwards. So from before that, I was in Pondicherry, and before that, I was in CMC Vellore. So after coming to AIMS Jodhpur, all my students are doing research in palliative care. Now they are interested in palliative care. They are also started joining the different palliative care courses. So it is like we need to encourage our students. Okay, those who are interested, it is not a force. We can give them a suggestion to do this, because there are n number of topic we can study. Okay, we can, because only we are the one, we need to generate the evidences for the future students. Okay, so you can, like many principals, faculties are here, please encourage your students to do a small topic on palliative care. Okay. And nursing management, we can teach the leadership skill for implementing palliative care program, discuss policy development, resource allocation, quality assurance, highlight the interdisciplinary teamwork in hospitals, hospice, and home care. So what all we can do? Make a model of compassionate care in clinical practice, develop and implement a palliative care curriculum. Like we can have a small discussions, like every Saturday, like we have a small pain and palliative care department in our institute. Okay, only 7-8 people are there, but every Saturday we have a discussion on one topic. Like you can also plan like that, weekly 1 hour we can take one topic and we can discuss about how to take care of this patient. Like that we can have a small discussion, and we can have presentations, case presentations, debate. We can have a debate with among, like I have a first year students, so I used to give a topic for a debate. Like all the topic I will be giving on palliative care. Okay, so we can guide the students. So we sensitize, like we have 100 students in our class. So I sensitize 100 students. They take very interestingly. Okay, we can motivate seminars, symposium, and group discussion on palliative care. And we can also advocate for palliative care policies and collaboration partnership with the local palliative care team. And we can invite the people from the local palliative care institute for a guest lecture. And if you are having a palliative care unit, and you can go as a guest lecturer to give a talk about the palliative care, and you can provide resources like guidelines and access to online modules to people who are interested. And we can encourage the faculties to attend conferences. Like every year we have a international palliative care conference. So this year we are going to have it in a Bhubaneswar. Let's see how many of you are coming, and we will be, you have to come and meet us. We will be there. Shiva will be there. I will be there. Okay, you people should come and meet us. Okay, so you have to encourage to attend such type of conferences, webinars, and certificate programs in palliative care. And for a clinical postings, be a partner with the palliative care units or hospices to provide the hands-on experiences. Like when we are taking a students to a educational trip, why don't you take to such type of institute at least one day, so that they can visit and then they can have an eye-opening on palliative care units. For research and evidence-based practices, encourage faculties and students to encourage palliative care research and apply findings in education. So we can give incentives to people who are interested in doing palliative care research, and we can encourage them for give them a certificate who are interested. And please select the people who have a attitude to serve to those patients. Okay, or teach to on palliative care. Okay, there are many people who are doing a certificate course just for a namesake. Okay, it is not going to be useful to anybody, not to the patients, not to the caregivers, not to our profession. Okay, you recognize some awards to people who are doing outstanding work on this, and you recognize them. Like in a small meeting also you can recognize. So that particular person took care of this patient. She has done wonderful. And if she is interested, we can send her for a training. Like that, we can recognize them. We can organize CNE, FDP program, conferences, workshop on palliative care, and we can motivate specializations. Okay, if all of us work together, we all can achieve more in palliative care. Okay, according to me, nursing is not at all separated from palliative care. If you integrate palliative care principles, all our students would be a competent, okay, and they will be able to provide a holistic care to our patients. Okay, thank you so much for an opportunity given. If any questions, I would be able to answer. Thank you so much.
Thank you, ma'am, for the nice presentation. Actually, you made it very clear and it was very simple. And you really talked about real integration of. So it was very much impressive.
Thank you so much. Any other doubt or anything else? Do we need a syllabus? Do we need a curriculum to teach this? Hello? Why do we have to expect? Definitely one day, if you influence, definitely one day it is going to be. My mobile number is, anytime you all can approach me. Okay. My mobile number I will share. Even if I don't answer immediately, I will answer later. My mail ID is this is my mail ID. Please approach me. Or you can also contact Shiba.
Yeah, I will share it, ma'am,
Okay, okay.
through the WhatsApp group.
Yes, yes, okay. Any other doubt you have? Anything you wanted to? Do you have any difference of opinion?
Maybe a little practical difficulties for the teachers to integrate it from the very first year, because we see lots of resistance.
Yes,
So it really requires lots of motivation and conditioning. Faculty conditioning is required.
yes, yes,
Uh,
yes.
this is a real life.
I still face, but I never give up.
Yes, but with strategies we can achieve this. But
Yes,
initially, and moreover, the nursing education implementation is not uniform. So each institution is different. Some selective institutions, they teach above standards, some places below standards. So these are all problems which is not in our hand. But wherever we practice in our boundary, we can implement it. So for that, definitely faculty orientation and sensitization is required. And
definitely, definitely.
others should accept.
Yes.
So anyhow,
Definitely,
slowly.
ma'am. Definitely, we'll be facing a lot of challenges. Because I also have come from all those challenges only, but it has shaped me now. I know how I will look for any
See, and
opportunity.
students and faculty, their attitude will change only if they work in a real life situation. So simply
Definitely.
reading
Yes,
theoretically will not make attitudinal changes. If they see a person who is really struggling for death, that time it will create a change. So they need to be put in that practical setup, as Keertana said. So that
yes,
is highly important.
yes. We have to look for an opportunity and
Thank you very much, my faculty. Anybody else has any other opinion, you can please share.
Anything else? Or give me any idea if you have.
Ma'am, in the current syllabus, it is given as a visit to palliative care. Your suggestions, ma'am, for visit to palliative care. Maybe a visit where real patients are there. That may be a chance for the students to explore
Yes,
more on this
hospices.
topic.
Like you can look for hospices. Hospice
Yes.
or like organizations like Pallium India or
Mm.
every, like Shiba will tell you if you belong to every state, there is one state coordinator under Pallium India. Okay,
Yes, ma'am.
you can approach Shiba. She will tell you whom to approach to take your students for a visit.
Yes, sure. Thanks.
So currently we have 20-hour palliative care module. Among that, 15-hour theory session and the 5-hour clinical posting, I think so.
At least at 5 hours, they can take them for a visit to hospice or a
Yeah.
palliative care unit.
Yeah, most of the nursing colleges lived in Trivandrum, so they used to come to visit us with the students. The BSc nursing second year students used to visit us after the theory session.
Okay.
You need, I will find out the places and let you know.
Yes, ma'am. Yes, ma'am.
Please let me know the place and the time period you want to go there, so that I can able to talk to them and arrange a visit.
Yes, ma'am.
At PSG, we have a palliative care unit.
Yeah, and that Coimbatore Cancer Foundation is also there, right?
Yes. Yeah, it is functioning with us only.
Yeah, yes, yes. Now Dr. Sridevi is there. Please talk to her, and I will arrange a visit. Don't worry.
PSG.
Yes, yes. Actually, PhD, that CCF is Coimbatore Foundation is collaborated with PSG. So PSG have given, I think, 10 palliative beds for palliative care. I think so.
Yes.
So in 2023, I went there, and 2 days workshops were there, and they trained PSG. That management had sent 3 nurses for the training, and I don't know currently they are working there or not. So let me find out.
Yes,
Anybody
it happened.
else?
Now also, through CCF only, we PSG faculty had joined for this
Oh,
course.
good.
Okay.
So, I strongly recommend from the first year nursing itself, you have to teach palliative care, because when I come to palliative care, I realize that we can able to that teach many things, because if you take a bed making procedure. So we know we used to train the nurses, nursing students to make a occupied bed and unoccupied bed, and also they know how to change sheets from a bedridden patients. Anyway, just imagine a bedbound patients. One day the doctor will be saying like nothing more we can do. You can take your loved one in your home. So who will take care of the patient? The caregiver is the person to take care of the patient, right? So the caregiver doesn't know how to change the sheets. Just imagine. So from that onwards, that bed making itself, they need to that demonstrate. So if you demonstrate well, they will understand the present. They can able to supervise before they discharge. Before we discharge the patient from the hospital, at least one day demonstration, and under the supervision of the nurses, the caregiver should change the sheets. Otherwise, what happen when they go back, they will change the sheets. Their intention is good, they need to change the sheets, they will pull the sheets under the patient. What happened? Because of that, pressure sore will develop. So that is also important when we teach bed making to the students, you have to tell them whenever we plan a discharge for a bedridden patients, you have to demonstrate this to the caregivers and make sure that they can able to change the sheets without a support. So that is very, very important. From this point that onwards, you have to train the students.
Yes,
This is
importance of changing position,
yeah.
importance of shifting patient from wheelchair to bed, bed to wheelchair. That time and all, like we need to teach about like shearing force, pressure, friction, why they have to avoid all those things also we have to teach. And NG tube feeding. What we are the same procedure only repeating in palliative care also. No, if you teach them in the first year itself properly, then somebody said that it is very difficult to incorporate in first year. These are all the basic procedure we are teaching in first year. So if we teach them, like such type of patients will come across in the community. We need to teach to the family caregivers. So we need to prepare them very well, like especially death care. Death care is the first year procedure. So how they have to get prepared to take care of the person who's nearing death. End of life care, we are teaching them in the first year itself. So it is like it is in our hand to prepare, and tracheostomy care, hair wash, and all the eye care, ear care, oral care, all are first year procedure. This one basic procedures, everything. Okay, so what we are teaching to the student, we also teach them how to teach to the caregivers, so that it is possible. It is in our hand. It is, as I told you, palliative care is not away from nursing.
Especially so when we talked about the death care, so as ma'am has already mentioned, after death also we have to respect the patient, that body, no? So that is dignified way. We have to provide a death care in a dignified way. That is also you have to tell.
Any other points you want to add on, so that we can pass the information to a next batch? Jennifer, madam, Vijis, you people are not at all giving any idea. Jennifer, madam. Hello, please give us one idea how we can improve. Why nobody is speaking?
So tell me your suggestions, because we are planning to do the same thing for the next batch also. If you have any other suggestions, please tell us, so that we can able to include that ideas also. From the silence, I assume that this is enough.
Was it useful or?
Yes, ma'am, the session was very useful. Integrating in each subject you told, that was very new concept for us. So that we didn't think in that way. We usually think it should be a separate module or it should be a separate subject. But integrating in each subject was very new concept for us. We will try to implement to our students. Thank
Yes,
you so much.
Thank you, Keetana B, for taking it positively.
So if they don't have any suggestions, we can wind up, ma'am.
Okay. Thank you so much, Shiba and Hannah.
Thank you, ma'am, for the excellent session. Thank you all for your participation and inputs. Thank you.
Thank you, ma'am. Thank you.
Thank you.
Tomorrow.
Bye bye.